Okay, we're going to do just a short presentation here, 4 or 5 slides to finish up on the renal system, urinary system. And we're going to talk about the functional development of the kidneys. We're going to talk about aging in the urinary system. So functionally, kidneys are developed by the third month. And what we see is amniotic fluid. That's actually urine that has been produced by the baby. Urinary system of a newborn. The bladder is small. Urine cannot be concentrated for the first couple of months, and so babies pee all the time, and they really can't control when they pee. It's just when the bladder gets full, it starts the urination reflex. Now, typically this resolves after about the age of 2 years old, but some people can have difficulty with the urinary reflex up until their school age. So it says that babies void 5 to 40 times a day. I'll tell you the average adult voids about 7 times a day. So I'm leaning toward the 40 times a day or more as the standard. Now, developmental aspects, control of the voluntary urethral sphincter. I said 2 years. It's about 18 months when it first starts. But complete nighttime control may not occur until the child is 4 years old or older. Urinary infections are the most common problems that we see with people before old age. And urinary infections tend to be E. coli, type of bacteria that is in your digestive tract. Again, the proximity of the urinary tract to the digestive tract makes it quite easy for infections to occur, particularly when we're talking about females. So urinary tract infections, 80% of those are made by E. coli. Now, aging in the urinary system. Just in general, the nephrons decrease in size and number. But keep in mind that we only need 40% of our full capacity, so this loss quite often makes no big difference or no noticeable difference. The bladder does decrease in size and tone, which can make a difference in that people do need to urinate more frequently as they age, and you have less muscle control, which manifests itself as incontinence. You just may not be able to control when you urinate as you get older. Now, a couple of things associated with aging. You are more likely to feel urgency. That is, really suddenly have it pop up that you need to go pee. Frequent voiding of small amounts of urine. There is something called nocturia, which is that you have to get up during the night to urinate, and this is quite often an occurrence with men who have swollen prostate, because the prostate gland actually loops or goes around the urethra, and it can clench the urethra so tightly that you cannot really void everything, and as a result you have to void more frequently. Incontinence, that is a loss of control. We see that quite often in the elderly. And urinary retention, common in males, and I just mentioned that with the prostate, but we get a hypertrophy of the prostate gland, which clamps off the urethra, which prevents us from being able to void completely. Now, that is all of this presentation. I know I said I would talk a little bit about bicarbonate. Just give you a real quick thing here. Bicarbonate is a buffer, and buffers are weak acids, which when we get it keeps rapid changes from occurring in our bloodstream, because if we get too basic, then this will absorb hydrogen ions, if we get too acidic, it will absorb hydrogen ions, and if we become too basic, then it will actually dissociate, releasing hydrogen ions into the bloodstream to maintain the appropriate pH balance. So that's really all you need to know, is that the bicarbonate system is a buffer. We have other buffers as well. We've got protein buffers, but the big one is the bicarbonate system. And it, along with a respiratory system, allows us to maintain the appropriate pH in our blood. The respiratory system, when we get acidic, we breathe a little more rapidly, and that blows off extra hydrogen ions, or actually carbon dioxide, which dissociates in the bloodstream to form an acid. So that ends up changing our pH balance. And that's all I have for this. So thank you, and I hope you find this material helpful.